Hi, I'm Kurt VandenBerg. I'm an orthopedic surgeon here at Children's Hospital Colorado, and I specialize in sports medicine injuries for young athletes. Also an assistant professor of orthopedic surgery at the University of Colorado. Physical therapy is so important for just about any surgery that we do that I can think of. And the big surgeries we're doing include knee, hip, shoulder, but also elbow and ankle. In the knee, a lot of the surgeries we do are ACL reconstruction, for example, or meniscus repair, patella stabilization surgery, or various cartilage repair procedures. The hip, it's often impingement repair surgery or labral repair. In the shoulder, shoulder stabilization for shoulder instability. But also, again, the elbow and ankle for different arthroscopic cartilage repair procedures. All of these require a significant postoperative recovery, which includes physical therapy. So having the physical therapy piece is so important, and having the patients understand that and the importance of doing the therapy, but also doing the exercises at home as they progress through their recovery. Well, with young patients, the short answer is I don't always know that they're doing the therapy I prescribe, but we do everything we can to put them in a position for success and give them the resources that they need to have a successful outcome and be able to return to the activities they want to do. These are young patients, these are young athletes. One of the things we have to do is make this fun for them. We have to make it rewarding, and it's my job to communicate to them the importance of physical therapy and that this is going to be incremental, baby steps, a little bit at a time. But if we stick to the plan, we stick to the protocol, eventually they're going to make significant improvement and be closer and closer to returning to the activities that they want to do. Taking care of any patient is rewarding, but there's something really special about being able to take care of young athletes and help them get back to the activities that they love to do, the sports that they want to participate in. Young patients, for one, they heal differently, and we're dealing with a different set of injuries and issues and types of surgeries than we do in adult patients. And helping these young patients understand the importance of physical therapy and having specific protocols in place, stepwise processes as they return to their sports, can really put them in a position of success. Some of the resources and tools we have to help our patients recover from their surgeries and from their injuries are having specific protocols in place. These are young athletes who are returning to various sports. These often, in some cases, are high-risk sports that are going to put them at risk for re-injury. So having a plan, having a process in place where they understand the stepwise progression that's involved before they can return to their sport safely is really important. And a lot of time has been spent by our physical therapy team to look at these protocols for each of the specific surgeries we're doing, and also understanding that each patient's a little bit different. This isn't just a specific time frame or a number of weeks or months. Every patient's unique. We have to take them where they are and help them recover on an individual basis to return to their sports. We're very fortunate here at Children's Hospital to have a motion analysis lab. This is a really unique resource that we have, one of only a few really in the country of its kind. And this is a tool that we can use. In my practice, I use it largely for post-surgical recovery. ACL reconstruction surgery, for example, comes to mind because we really use it a lot for those patients as they're entering various stages of their recovery. For example, as they're, 6 months out from surgery, we will test them in the lab, and we can look at our motion analysis data and pick up on really subtle, nuanced biomechanical deficiencies that patient has. And that's an opportunity for us to still catch that at an early time point and intervene and try to help them improve their biomechanics before they have a full return to their sport. Having the right physical therapy team and being able to leverage some of these technologies is such a valuable tool that we have. We have a team of therapists dedicated to young athletes that understand the young athlete. They understand their specific needs. And being able to use this technology brings some science to it. It's not just physical exam or various time points, but every patient's unique. Every patient heals on their own time frame. And being able to understand that, but also objectively look at our data and intervene with that and improve their biomechanics is going to help our patients have the best possible outcome they can, returning to their sports with the lowest risk for re-injury possible. If there's a patient we can help you with, we would love to do so here at our Sports Medicine Center at Children's Hospital Colorado. Please see our information here below.